The thing with oral anticoagulation, and particularly the factor Xa inhibitors, is that since they thin the blood, they may lead to bleeding. And this bleeding has a high mortality rate, and the bleeding is dependent on the anticoagulatory activity. And since we know that, we do want to prevent that patients suffer from an increase of that hemorrhage. And this is what all this is about. How do we treat bleeding that is associated with oral anticoagulants? And this session was about the factor Xa inhibitors. There are ways, several plausible ways to try to achieve a reversal of anticoagulatory activity. The problem at the moment is that we do have one drug that was studied, but not in a randomized controlled trial, but more in a prospective case series. So there is no real comparison. And this is what all this is about, because when we are thinking about an alternative therapy, then we have to use data that are not of that high quality as the case series is. So on the one hand, we have a drug which is currently approved by the EMA, which is Andexanet alfa, and that was particularly approved for the reversal in case of a bleeding that the patient was on either Rivaroxaban or Apixaban. The data we have for this drug comes from a prospective case series, and that has shown that the overall hemostatic efficacy is somewhere between 80 and 85%. And at the same time, we do know that application of that drug does lead to a normalization of factor Xa activity. On the other side, there are at least a few plausible alternatives. The most plausible at the moment is the prothrombin complex concentrates, which also include factor X, not in the activated form though. But the data we have for those PCCs, they all come from observational studies, and they are going in both directions. There are a couple of trials that show it may have an effect, and there are other trials that show that it does not have an effect. So at the moment what is going on is people follow the recommendation, which is when Andexanet alfa is available, then it is recommended to use Andexanet alfa. If it is not available, then people may consider to use prothrombin complex. The good thing about all of this is that there is a trial going on where Andexanet alfa is randomized against what is called standard therapy. And we know that probably most of the patients will receive prothrombin complex. I cannot tell you at this time. We'll see how effective prothrombin complex will turn out from the ANNEXA-I study. There is another idea of what you could also use, which was tranexamic acid, and there was just a trial here presented at ESOC, the so-called TICH-NOAC TICH trial, but that trial was negative, though it was premature, and the reason is it was prematurely stopped because they ran out of funding. The problem with the TICH-NOAC trial is that both groups actually received PCCs, so it was not a placebo-controlled study. It was actually placebo versus tranexamic acid plus placebo.